Welcome to Focusing on You, sponsored by the Hope Abounds Cancer Network. We're here today to talk about caregiving. My name is Lisa Cawthorn. I'm a survivor. I was also a caregiver and continue to be for some friends occasionally, and I'm a nurse that volunteers at Hope Abounds. We are really blessed today to have someone with us. Her name is Debbie Boyle. She has a lot of initials behind her name. She's got a Master of Science in Nursing, RN, Advanced Oncology Certified Nurse, FAAN, which means she is a fellow in nursing. She's also a clinical nurse specialist. She has spoken more times than I have fingers and toes, authors, articles, editor, and I will say she is a nurse's nurse. She has talked many times about compassion fatigue, and she really has done so much work in making families and patients feel better by her holistic care. She's written a book, so it's one of the few books out there. It's called The Caregiver's Companion. It is available on Amazon.com, so we'll put that information on this session. But right now, I want to welcome Debbie. And Debbie, will you tell me how you got the idea for this book?
Well, thanks, Lisa, and thank you, Hope Abounds. It's so nice to be part of your network. Well, I was a young nurse in the early 1970s when the President Nixon at that time started to wage this war on cancer. And I had the opportunity to be on one of the first inpatient oncology units in the United States as my first job. And although at that time I didn't have any cancer in my family, I really had no experience in working with cancer patients and their families. I was very sensitive to the needs of the family caregivers at the patient's bedside and felt that they were really unknown soldiers, excuse me, standing there, and we weren't really addressing their needs. And while we were focusing on the patient and trying to get them through treatment, I always felt that they needed some extra care in their journey through the cancer experience as a caregiver. And what I found over the years is what's helped me learn and cope is that I write notes, I write down stories, I put them in a folder, and I started doing that back in the 1970s, always with the thought in the back of my mind that I wanted to write something for caregivers. And over the years, I've kept abreast of the literature and looking for a resource for not just for cancer caregivers, but also any caregiver caring for a loved one at home with a serious illness. And what I found, I couldn't find anything in the literature. There were memoirs, but there weren't sort of a guide or a template to help families know what to expect and perhaps offer some advice and recommendations based on years of experience. So that really has been the impetus for the book. And so it really has been a labor of love over many decades, but I'm just so happy that it's out. And especially because since I started this quest and interest in the family caregivers, I have become one, been on the opposite side of the bed, and really got to feel and understand firsthand some of the dilemmas of the plight of the family caregivers. And as a daughter, particularly of a father with cancer, and my husband, I really came to appreciate that we expect so much of family caregivers with very little preparation, very little support, and nominal kinds of teaching to help them, excuse me, assume these many roles of their caregivers.
Mm-hmm. Well, that is a mouthful, and anyone who's been around someone who's ill and had to try and manage everything that's going on, it is very challenging. So Who would you define as a family caregiver, and what do we currently know about family caregivers?
Well, the Institute for Patient and Family-Centered Care says that a family is two or more people that are linked or related in any way. It could be biologically, it could be legally, it could be emotionally, and that's the generic description of family. And we can only guesstimate how many Americans are out there doing some degree of caregiving, because it's very hard to put our arms around it, especially because you may be a primary caregiver or you may be a secondary caregiver who's perhaps helping your mother with your dad's care and whatever. So it's estimated that there are about 44 million Americans involved in some type of caregiving, and I would bet that that's a low number. I'm sure there are many more than that. And interestingly, when we think about caregiving and who is providing care to patients across the nation, the major provider of care are not the nurses and the doctors, it's the caregivers. They are the ones who are there at home with the person who's sick 24/7. And so I think we need to place added emphasis on the importance of their role. They know the patient the best. We need to include them in more and more discussions about what would be best for their loved one's care. And what is most important, I think, that we need to recognize for caregivers is that the expectations that they overnight many times will be the nurse, will be the pseudo doctor, will be the social worker, dietitian, the pharmacist, the insurance specialist, you name it. We expect lay family caregivers to assume those roles with no preparation. Especially in the hospital setting, we give them prescriptions and they say, come back to the office in 2 weeks, but nothing about how to turn your loved one, how to get them out of bed, looking at the medication regimens that they may be on. And when you look at other milestones in our lives, like having a baby, learning to drive a car, taking on a new job, you all get education about how to do that. You get an orientation, you're buddied up with someone to help you learn these new skills. And yet there are very, very few formal programs in the United States that help lay caregivers assume these novel roles. And this need is only going to escalate in the future, because people of my generation, the baby boomers born between 1945 and 1963, we are the largest group, and we are aging exponentially as I speak. And because of other societal trends, not having as many children years ago, children moving away from home, women in the workplace, we can't expect that there's going to be a ready caregiver there able to assume the care of an ill loved one. So we need to think differently about what's coming down the road and really begin to take action soon in developing a different way to prepare the caregivers for their role.
Well, looking back, and I'm sure you'll agree, you talk about thinking about what nursing was like in the 70s. And I remember long ago attending a conference where they talked about hospitals being more like mini ICUs, that you're going in for acute care and then you're coming out and then your family has to deal with it. And, you know, we used to admit people to the hospital for a colonoscopy, and now we just, a colonoscopy, I can't believe you used to do that. People were in the hospital a lot longer. And now you're right. I mean, the turnaround time is so quick for folks. And now the caregivers are thinking, I have a really sick person to take home. So you talk about some of the new roles that people have to, be thrust into without any preparation. So what other issues do family caregivers face other than just, how to turn a patient? Like, what would you say some of the other issues that they have to face are.
Well, one of the things that I mentioned in the book with some research, and the book includes some formal research from the professional side, as well as stories from families that I've interacted with. But I think specific to the caregiving in the oncology experience, we are asking them to understand and retain and comprehend very threatening information on this platform of anxiety and worry. And several important articles from the literature say that when we get ready to discharge somebody home from the hospital, what we tend to do is focus on their illness rather than the skills that they're going to need, like, again, what can expect, and how maybe to make sure somebody has a pain medication at nighttime so that they can sleep, and those sort of activities of daily living. And so families aren't going to remember what has been told to them in a very cursory way because of this platform of worry and anxiety that they have. I think another stressor that family caregivers have is they're expected to be the information broker. So you may have sister-in-laws, nieces, nephews calling and wanting to know, how their uncle is, and so you're in the position of dosing out different amounts of information. Now, however, there's a great resource that perhaps many of your people in your network know about, and it's called Caring Bridge, and it's a free communication tool where you can add on to what's going on with your loved one on this website, and family and friends can check in on a daily basis rather than have to call the spouse, for example, and get an update on what's going on with their patient. So with the advent of a lot of this novel technology, I think it's going to help some of that burden that's put on, especially the spouse, I think, of keeping everybody afloat in terms of what's going on. And the other thing in this day and age is many caregivers have to continue to work. They don't have the luxury of having 3 months off or while their loved one is going through treatment. So while they have their usual role responsibilities in their family, they now may be asked to do more and more, perhaps, that the person who's ill is unable to do. And so rather than take things off your plate to allow you to assume these new roles, we just keep adding and adding and adding on to what's expected of them. And certainly worries in this day and age about financial implications of illness. And so the stress of trying to keep up with their job, and as well as their job at home with their loved one in this nurse's cap or stethoscope that now they are expected to assume. So, and again, with many times it's little warning. Many of our patients and families, this is a new information. This comes to them over a matter of days. And so their ability to assimilate what's expected of them isn't going to be an easy task. And families, I think, need to feel comfortable knowing that it's okay to ask questions more than once. It's okay to say, I didn't really understand what the doctor said when he said this. That I often say, I expect you to have ongoing questions. You're not going to get it with just one little 10-minute conversation about, a therapy regimen or whatever. I think also when there's older caregivers, they may have their own health issues, and they're expected to be, again, the caregiver, the nurse, the doctor, social worker of their loved one, and yet they may have their own diabetes, a little heart failure, whatever it may be. And they tend to put their healthcare needs on the back burner because they see the person who currently ill has more pressing needs. And so we find that they skip appointments that they have or don't get their medication refills unless there is a support structure being a caregiver to a caregiver. And I also think there is many times the expectation to be strong, that if my children see me cry or become upset, there's going to be this domino effect where then they're going to be upset. And so I've got to sort of be the one with the stiff upper lip. And this is often a very big issue when it's a spouse who's ill. You know, we see some older couples who've been married for decades and always talk to their spouse when they had a concern. Well, now they find themselves, well, I can't tell my husband I'm worried that the treatment isn't going to work, but yet he's always been my biggest support. So they have to find themselves a new source of support, somebody that they can bounce off their worries and to talk about. And I think specifically in oncology, a very big concern of caregivers are medications. It's not unusual to leave the hospital with anywhere from 6 to 12 prescriptions, maybe ones you were taking before, but new ones added on to that. And this can be overwhelming. Families worry they're not going to give them the right amount, they're going to forget, they're somehow going to harm their loved one. And so this is many times a very big source of support that we can help, the professionals can help with. I heard spoke a number of years ago to a group, and a nurse in an office practice said that what they do is they tell new patients and families to identify someone to be a medication partner. And that person's job is to help the patient and the caregiver keep track of medications, get refills, jot down when patients are having problems with their medications. It's that big of a job that one person is needed to complement what the patient and family currently is doing. So that's a very, very big concern, I think, especially at the beginning of the caregiving journey.
Mm-hmm. Well, you really addressed how overwhelming it can be, all the tasks that are involved. That in itself is overwhelming. And then you talk about sort of the emotions that go along with maybe a new diagnosis or a change in the diagnosis. So what advice or what did you address in your book about coping and emotional responses and how to deal with all of that?
I think the main piece of advice or information to get across is that we cope with healthcare problems and stressors the way we've coped with other problems in our past. We're not going to change when we are confronted with a serious illness. So if I'm a talker, before this happens, I'm going to want to talk about what's going on. And on the contrary, if I'm what I call a swallower, you sort of swallow those negative feelings and don't like to talk about those feelings, that's the way you're most likely going to cope with the current healthcare challenge. So many times, adult children have said to me, you know, my dad's not talking to my mom, and you know, he needs to share with her what he's thinking and feeling, and we've got to get him to talk. And then I would say, well, what was your dad like before this? He would never say anything that was bothering him. I said, well, that's what we have to expect now. You know, he's not going to change. That's his security blanket, the way he coped before. So I think this is the same with us as caregivers, as siblings and children. We're gonna come to the bedside with our own styles and norms that we're going to use in terms of coping. And on the negative side is if there's problems in the family, if it's a family that still has a lot of controversy as a result of divorce or other estranged adult children, unfortunately, this current health crisis isn't going to make that better. Most likely, it's going to potentiate some of those ongoing problems within the family. So you really need to be very introspective and say, you know, what were we like before this happened, and what can we expect now? That's not to say people can't change, but it's unrealistic for us to expect very grand sort of differences in coping because of the current health crisis. And this also relates to information, that if you're an information seeker and information helps you cope, even if it's bad news, I want to know, or I want to do a literature search, or, I need to know everything I can. If I, as a nurse or a doctor, withheld information from you, I would probably increase your stress level. And on the contrary, if I'm a low information seeker and I give you too much information, that's also going to increase your stress. So one of the important things that I think you need to tell your treatment team at the beginning is what dose of information is going to help you. And oftentimes it may be different. I'm a high information seeker, my husband's a low information seeker, but physicians generally don't ask you about that. And so you may not be getting your information needs met. So let them know, or my husband's the type that doesn't want to talk about things and whatever, but I'm not like that at all. And I need to know what to expect, especially if it's an emergent situation at home that I need to be aware of. So think of that dosage as it relates to your anxiety and worry, and letting as many people know. Nurses are your biggest confidants and helpers. I heard someone describe them as puzzle fixers, putting the pieces together. And this becomes particularly difficult when you've got all these consultants. One tells you one thing, another one tells you something else. You're a layperson. You don't know how to, digest that information. So going to a nurse or nurses that you feel comfortable with and saying, I don't understand why the heart specialist said that, and yet the surgeon said, oh, don't worry about that. And related to that also may be that the internet is not always your best resource. And we are unsure about, where some of that information is coming from. And the other thing that I find is the internet may give you global sort of information about an illness, but it doesn't piece together all the individual specifics of your case. And I have an example from many years ago that really brought this home for me as a nurse in a chemotherapy clinic. There was these group of 4 ladies that always came in on Thursday mornings to get their treatment. And I could overhear everything they were saying because I was in the room next to them. And they'd start talking, they were breast cancer patients, and they'd say, well, what's your estrogen receptor status? How many lymph nodes did you have? What hormonal therapy are you on? And you can see when the other lady there said a different answer, they were getting all flustered, thinking, oh, I'm not getting that treatment. Maybe I'm not getting the wrong thing. But breast cancer is an excellent example of there are so many entities that guide decision-making for the physician to tailor a treatment to you on a whole host of variables. So it's important to remember that no 2 patients are ever alike. And try not to compare yourself and say, well, my husband had colorectal cancer, well, so does mine, but still, they may be very different risk factors associated with each of those 2 men.
Yeah, I used to talk to patients and they'd say, well, I looked up, I call it Dr. Google. I looked up the information on Dr. Google and it said, 90% of people with this diagnosis don't do well. And I'd say, well, where are you in that 90%? And they'd say, I don't know. And I'd say, exactly. So you have to look at the statistics and realize their numbers, but it's not really the people involved.
Right.
So yeah, I can see that conversation happening with breast cancer patients too.
Yeah. And we all know, again, that it's the individual nature of everyone's case is something that most of the patients don't really understand. I had another caregiver, an older lady whose husband was down in surgery, and I stopped by the room to see if he was back yet. And I saw her in there crying in the corner, and I asked her what was wrong. And she said, you know, I can't take losing my husband. I lost my first husband 2 years ago, and I just can't go through it again. Well, it happened that her second husband had a very good prognosis, you know, but she assumed because they both had cancer that they would end up the same way, which of course wasn't. So, and a lot of people get information from their neighbors or other sources, which may not necessarily be the most evidence-based information that you need to know.
That's right. So switching gears a little bit, we hear a lot about the sandwich generation where we have maybe our parents or aunts and uncles to take care of, but sometimes that caregiving happens when you have children or teenagers in the home. So in your book, you make a special point of concerning children's reactions to illness to an adult family member. What is important for adult family caregivers to know about their experiences?
You know, my interest in the children's reaction comes from several very poignant experiences I had in working with older patients, and the central person in their life was their grandchild. And I would ask the middle-aged children of these older adults about, you know, what have you said to your son about what's going on with grandpa? And almost always they would say, well, you know, they would try to shield them. They would try to sort of minimize what was going on. And what I have found through the years is that just because children aren't talking doesn't mean they aren't thinking, and they're trying to put things together. You know, they see differences in the home. They see mom cry. You know, where is grandpa? He always came to my soccer game. And so while we think we are protecting them, many times we're doing them a disservice. And they need to feel included and part of this family network and share in the worry if that may be. So in the book, I do have a guide about developmental considerations based on the age of the child. So it may be a young child with a parent in their late 30s, or it may be a grandchild or whatever. So I'm trying to give some advice and thoughts about how to approach it with the child. It has to be based on their age, and the older they are, the more we are able to explain what may be going on. But look at how we have problems as adults dealing with our feelings. So you can imagine as a young child, they really need a lot of help and support, and need to have an open book in terms of their ability to talk to someone. In grade school children, it may be the teachers who are hearing what they're worried about, and the mom or dad may not even realize that he has those concerns. So, but they have to have an outlet and at least an opportunity to be able to vent their feelings. And oftentimes we need to ask them first, what are you worried about? So that we don't overwhelm them with information. Let them tell you, and then address their individual information needs in that regards. So offering them the chance to share their feelings. And books also there's quite a number of books out there specific to cancer and helping children understand, you know, at a developmentally appropriate age. So look for resources. I'm sure Hope Abounds has a listing for families that would be helpful in that regard.
We do.
They need to, I guess the main idea too is that they need to be included and not left out and shut out of what's going on in the family experience.
And sometimes I think when children ask questions, you start out with simpler answers and see if they're satisfied with that, or
Right.
they want to ask more questions and more details. So if you're opening the dialogue, at least you're giving them an opportunity to ask some questions.
Right.
Yeah.
And I think the other thing is role modeling sharing feelings. if you're upset, and crying is such a normal response to these crises and yet we, you know, when you think about it, when you get upset, you apologize, you say, oh, I broke down or I lost it. Very negative connotations to a normal response to a sad situation. But if you do cry and to say, you know, mom's upset, you know, she's worried about grandma, and then that may give the little one say, oh, I guess it is okay to maybe if I feel sad or whatever. But they're very astute observers of what's going on in their family, and so they pick up a lot of clues, and so shouldn't be, you know, isolated from what is going on.
Right, right. So you talk about your caregiving experiences in your book as a daughter and a wife, and at the time, your daughter was 9 years old. So how did your caregiving and those roles impact your view of family distress? What did you go through, and how did you figure out how to navigate with that?
Well, Lisa, I always thought of myself as a very empathetic nurse with family caregivers. And even with the utmost empathy and compassion, I was not prepared at all. And I think these and competing demands on you can just be overwhelming. And my best example of that, I remember being in the bathroom with all the pill bottles all over the top of the counter, and on the phone with the doctor because my husband's nausea medicine wasn't working. I'm on the phone and he gives me advice about what to do. And I walked out of the bathroom, and so my husband says to me, well, what did he say? And I like blanked out. I was like, I don't know. I couldn't remember. I mean, just the angst was so severe. And I think, you know, if I had trouble in my caregiving, and I'm an experienced oncology nurse, how can we expect lay family caregivers to do this? I mean, I had that experience and background. So now what I found myself doing after that is when I would talk to caregivers, I would say, not, are you having problems, but what problems are you having? With this sense of normalcy. You're not going to get it right. You're not going to be perfect in 24 hours. And again, just like any other skill, as nurses, it took us years to learn how to problem solve and assess. So families aren't going to be perfect at it overnight. And they're very hard on themselves. I think they need to have a big dose of self-compassion and really focus on your intent. So it wasn't your intent to forget to give your husband the mid-afternoon antibiotic, but to say, yeah, I'm overwhelmed with all of these medicines. I've got to find a different way to keep track of things. So it's that self-forgiveness and compassion that you're doing the best you can in a very difficult situation. I think that is most important. And again, because of this platform of stress that you're trying to learn all these new things, you're maybe only going to retain 10% of what's been told to you. You're not going to retain 100%.
Well, so I do have a few more questions for you, but what are your main pieces of advice for family caregivers? We've gone over some things. What would you say, here are the biggies that you need to concentrate on?
Immediately what comes to mind is that you have to accept offers of help. People are not going to ask or offer their services if they're really not interested. And so when they do say, well, one of the problems at the get-go, though, is that many well-meaning people may say, let me know what you need. And well, as a family member, you may not know what you need, especially at the beginning. So one of the things that's in the book is a list of tasks that the caregiver can look at and anticipate, or at least say, oh, helping with the kids, getting them to school. I know my friend Judy would do that. I think she would do that. And sort of go through the list. And because it is hard for you to come up with this laundry list of things that you're going to need. But let the people help you that offer to help. And think of it as a gift you're giving them, that they truly want to participate and help take the load off of you as a family caregiver. So that, I think, is that, along with not expecting perfection in your caregiving, is most important. As I alluded to before, don't compare yourself to others. I remember a daughter of a lady with a mom with pretty bad dementia, and she was in a support group, and they were talking of other daughters were talking about their experiences. And this daughter came to me and said, oh, Mary Jane was able to keep her mother at home for 18 months before she had to go to a residential care facility. I couldn't do it even for 4 months. So, but maybe her mom had different things going on than your mom. Maybe her mom didn't have the rapidly advancing dementia that your mom had, and you were concerned about her safety as she wandered or whatever it was may be. So not comparing, I think, is very important. So I think asking for help, accepting help, and one of the things that I found did as a nurse that helped me as a family caregiver was, at the end of the day, I had to reflect on what I did do, not what I didn't do, the woulda, coulda, shouldas, but what I did do to help in both my father and my husband's care. And it may seem little or insignificant, but you need to take credit for those things that you did well. I was able to get the medication changed or a higher dose changed. I was able to ask my neighbor to help with the insurance problems because I didn't have time to do that. So you really have to make a very purposeful effort to acknowledge what went well rather than what didn't go well. And also, when people do offer to help, don't let those naysayers and critics help, because you're probably already going to be doubting yourself. So you want positive people who are there and are sort of going to help lift you through the experience. So pick your team, and pick your team early. Don't wait for crises to occur when there are major problems. At the get-go, say, who are those people that I feel that I can rely on to help me? And think of it as a temporary thing. It may not be something that's years and years, although some experiences are. Take the case of somebody with a traumatic brain injury. That caregiving, it may be decades that a wife, husband, or parents may be asked to do. And the other thing that I think helps is to say, this was a case of a husband, older gentleman, who was very concerned about how much added stress he was putting on his wife as she was doing the caregiving. And she kept saying, no, I want to do it. I want to do it. And the only way he could understand is, I said to him, well, what if your wife was the one who's sick and your husband, and you're the caregiver? What, would you want to help her out? Oh, yeah, I'd be right there. I would want to do everything for her. Well, I said, well, maybe you can see now how she feels that way too. So, putting the shoe on the other foot is an exercise, that can help.
Right.
I mentioned already about engaging with nurses, and that's very important. And maybe to say up front as well, I know I'm going to struggle with X, and can I call you, or who's the person I need to ask about whatever. And taking care of yourself is not, self-care is not selfish care. It's making sure that you have enough gas in the tank, your battery is recharged to be able to go on with caregiving. And think of it, somebody said once, think of it like recharging your phone. How many times a day or whatever you're recharging the phone? You need to think about that as well. And because in the absence of that, you are going to burn out. It's going to be very difficult, and it'll be difficult for you, and it may be difficult for your loved one. So even 10-minute snippets, and there is another list in the book of things that you can do for yourself. Doesn't have to mean 3 hours, every other day, but taking small moments to have time to sort of de-escalate, have some personal time, and acknowledge that you need that in order to continue in your caregiving role.
So your book ends up being a really nice combination of research and what people have found out about caregiving, and sort of the practical information for caregivers, exercises and lists and things that are super helpful, I would say, because as you and I have mentioned, when you're discharged from the hospital or you leave the doctor's office, if you're discharged from the hospital, they're more concerned with activity, diet, and meds. And that's about all you get. You may not get how to turn a patient, how to transfer a patient, when should you call the doctor, how do you adjust pain medicine or nausea medicine, or even, as we all know, constipation, which becomes a big problem. So do you have any final thoughts you would like to share with the listeners about caregiving? I can't stress how important I think this book is, because it does provide a little bit of a roadmap for people to get started and to have a path that they can at least get some advice on.
Right. I used to jokingly say when I started writing the book that I wanted this to be sort of the childbirth guide, what to expect when you're expecting. But I realized, with caregiving, it's not this sort of similar journey that everybody has. So I could only give them some sort of global thoughts and landmarks to consider. But I think the most important things are that you get a little bit of respite and you accept help and see that as a way for you to continue to engage in this many times overwhelming responsibility for caregiving. The exercises in the book are very intentional, and each chapter I try to keep short because I know many caregivers in actively doing the job don't have a lot of extra time. But each chapter has some sort of exercise to bring it on home to you, the reader. So one of the areas in the book, I think maybe even the first chapter, is when you are struggling with the why. Why did this happen to my husband? And you're really sort of trying to find a reason or a rationale. And at the end of that chapter are several short exercises to help you think more about that. And many times these are the answers you're looking for aren't out there. And so there's spirituality may be a source of support for you. But I have found that until I write it down, what I'm feeling inside, I'm not even aware of what's going around in my head. I'm not even aware that I'm really angry, or, I'm upset with my sister who's not helping out. But when you write things down, I think it just really gets it out on the table there, and then you're able to deal with it. And one of the exercises is to write a letter to yourself, and as if you were writing a letter to a good friend who was going through a difficult time. And that's a very poignant exercise as you give support to yourself and recognizing you're doing the best that you can. So hopefully all those little the things at the end of each chapter will help you be better reflective on what's going on in your own life as a caregiver.
Well, I know we've spent some time talking about this important topic, and there's lots more that we could talk about. People spend days and talking about this and writing articles and doing research, but I do want to really acknowledge your contribution by aiming this for sort of the unknown heroes, the caregivers, unpaid, and like you said, don't get any training. So I want to thank you again for talking with us on Hope Abounds. And again, the book is called The Caregiver's Companion.